Hello, everybody. Welcome to the community-based education session. You are year one, and we started this session a few days ago, and today is the last day where we are going to perform a little discussion with you for half an hour. And then you will start presenting your PowerPoint presentation. But before we start the presentation, I would like to run a discussion with you, with each one of you. You have the option of either tell us your aha moment from the educational material that you have read or watched as videos, or to tell us, according to your expectation, what community-based education came to enhance medical education in terms of the educational theories, against what's not available in the traditional curriculum. So you have the option of choosing just one of those two things to discuss it with us. Who would like to start? Raise your hand, please. No hands are raised so far. Well, Yusuf. Go ahead, Yusuf.
Bismillahirrahmanirrahim. Many thanks, Professor Talat. It's a great pleasure, really, to have this session with you. You are one of the pioneers in the field of community-based education. I'm going to choose the second option, how the community-based education enhance the modern medical education curricula. Basically, if we have a historical look to the old traditional curricula, where it stands and it is based on the hospital-based practice. It is the traditional schools, traditional medical schools. They are depending on the hospital-based education, where the intervention through the community, where involvement of the community, where learning and teaching through the community is not allowed through the learning activities. What is the community-based education and how it fosters the medical education? First of all, we need to know that the community-based education is the means or the methods by which community-oriented medical education strategy is implemented. And the community-oriented medical education strategy is the addressing of the community health problems and priorities.
Okay, thank you, Dr. Yusuf. At least each one of you will pick up just one thing that community-based education came to address in terms of the educational theories that we expect that it will enhance medical education. You said that in community-based education, the education process mostly happen within the community, outside the walls of the school, not inside the school like the traditional curriculum. Thank you, Yusuf. Who else? Raise your hand, please. Yes, Doha.
Actually, I learned, it was the first time I learned that Suez Canal University had a community-based education and community-oriented education. Also, it was the first time I get to know that community-based education can be integrated throughout the different subjects and throughout different years in the undergraduate course.
Excellent, Doha. So, integration.
Yes.
We speak a lot about integration. We advise all the health professionals to try to integrate their curricula. But then if their curricula is conventional or traditional, it would be very difficult to implement integration within the curricula without having an educational strategy like community-based education. Doha, stay with me, please. Would you tell me at what level community-based education goes higher in the integration scale of Hardin or Hardin's integration ladder?
Ladder? I don't know actually. Maybe I don't
You
know.
know Hardin's. You know
Yes,
Hardin's
it's 11
integration ladder,
steps, but I
right?
don't
How
know
many
actually.
steps? How
11,
many?
I think.
11, right?
Yeah.
So, what do you expect?
It's
Community
high up, but I don't know actually.
the highest one.
Okay.
Excellent. The highest one, which is
I can't remember it. I can't just recall it now.
transdisciplinary.
Yes. Okay.
Okay.
Yes.
Because the 10th level goes to problem-based learning, which
Yeah.
is interdisciplinary, and you are going to study with me problem-based learning when you go to year 2, inshallah.
Yeah. Inshallah.
Okay, so
Okay.
this is the highest level. And why do you think this is the highest level in community-based education? Because in the previous steps, usually integration happens by the faculty themselves. In
Yes.
problem learning, they are the ones who integrate the disciplines in the educational problems for the students. But what happens then in the community-based education that makes it even a little higher step than problem-based learning?
We deal with a variety of problems that originate from the community itself.
You can tackle a variety of problems as well, and we call it priority health problems in problem-based learning. But this is not why it goes a step higher. It goes a step higher because the students themselves do the integration,
yes.
while being trained in the community. See the beauty of community-based education? Excellent.
Yeah.
Thank you very much, Zainab.
Good evening, Professor.
Good evening.
I was really amazed with the part of involving social workers in this community-based education and how to put the guidelines between the students, the medical students, and the social workers. I think this is a very important part that should be involved in the curriculum.
Excellent. So this is your aha moment, right?
Yes.
Thank you, Zainab. Okay. Muhammad Siddiq.
Yes, good evening. Assalamu alaikum, everyone. Greetings. Actually, sir, the video which we saw, it was showing that there are obstacles and challenges when they are crossing the river. But we should integrate and community with students so that they are more empathetic to students. They know that what challenges they face and how we can educate them so that for any prevention or curative diseases, we can help them. So we will have challenges, but we have to overcome challenges. That's what I understood. It was nice to understand that.
So if you summarize what you just said in one word, like when we summarize the integration, what Doha described.
Then there might be, yeah.
And then we selected one word, integration.
So yeah,
how could you summarize?
Yeah. I can summarize that there might be a social, cultural, or any other challenges, and we should see the way through how to improve
the students, while going to the field work in community-based education, they are exposed to the challenges that they might face after graduation while practicing their profession. Thank you very much. What else? Others, please. Let me see. Mahrouz.
Thank you, Prof. Magdi. It's very nice to see you. You are my professor. I graduated from Suez Canal University. I think community.
So you practiced already community-based education.
Yes.
Tell us what community-based education would also address from the educational theories that we all know as medical education.
Actually, I love our formative assessment and peer assessment and community feedback, which is I already know. I was engaged in this in our college in this part.
Okay, so this is your aha moment. You didn't tell us exactly one of the beauty of the community-based education in terms of educational theories, but you told us your aha moment after remembering what you were doing during your training at Suez Canal University. Okay, thank you, Mahmoud. Let me pick up another one. We will all speak, so please raise your hand. Lower your hand, Mahrous. Yes. Okay. Ekrima. Do I pronounce your name right?
Yeah. My name is Ikrima in Arabic.
Akrima.
Yeah.
Oh.
Ikrima.
Yeah.
After the name of the Ikrima bin Abi Jahl.
MashaAllah. Okay.
Okay. Actually, I am new in the academic fields. Just maybe 2 years ago, I am become as assistant professor of my college.
And where are you from?
I am from Jove University, from
Saudi
Jove
Arabia.
City.
Okay.
Yeah, Saudi Arabia.
Yeah. Okay.
So I don't have that background about CBE. But what I learned from a few information previously, I think the CBA, it is focusing mainly in the practice. And this is what I saw now in my college. We are make our student focusing in the practical more than to be theoretical part.
Okay.
So I don't have that much to answer your questions with my
No, this is already very good that you noticed that community-based education focus more on the practical part of the medical curricula rather than the theoretical parts within the institute. So you send your students outside to practice by their own hands and to learn through serving the community. What a beauty. Yeah, very good. Very good.
Thank you, Doctor.
Okay, thank you very much, Mary.
Evening, Doctor. The video, Ain Shams University.
Ain Shams, okay.
Okay. The video was amazing. It really it summarizes what community-based education is, and I was amazed about that.
Which video? The video where I describe the community-based education.
The other video. The other one.
The other video of Suez Canal University.
The other video of the Suez Canal University, yes. And I think it was a long time ago. So I think this community-based education has been implemented at Suez Canal University for a long time.
Yes, that was almost 40 years old, but I intentionally include this in my course at the International Famer Institute and regional institutes, because till now, every time we try to update it, it doesn't give you the sincerity and authenticity of the first film that we shoot for the community-based activities at Suez Canal University.
Yes, it gave me this sincerity.
Yes.
Thank you so much.
So this is your aha moment. Thank you very much.
Yes, thank you.
Thank you, Mary.
Dr.
Yes.
Sorry, I don't find the button for raise my hand, so I can talk.
Good.
Yeah.
Go ahead.
For sure, I know there are many aha moments, but the video from Suez Canal 40 years ago, even the quality of video is reflecting how old was reflecting
Yeah.
how old it was. I think about the educational methods, it might be. I am confused between two of them. It might be the collaborative theory because the learners here are group of students in different countries, or maybe the constructive because the learners gain professional competences and it reflects on them, on their knowledge, on even their daily life.
Okay, I think we will explore more on that during the PowerPoint presentations. One of the groups will address this particular event. Okay, thank you very much. Who else? Should I choose? Samar? Samar, would you tell us your aha moment at least?
Hello, bro.
Okay.
Actually, this is my first time to come by community-based learning. After the readings, I feel that it's the bridge between education in the college for the student and the problem-based community problems. So it
Okay,
learned the student.
Let me correct the terminologies of both community-based education, not community-based learning, and problem-based learning, not the way you said it. But anyway, so what's your point here?
So I feel this is the way how the student could learn communication, work in groups, and understand the community problems.
Excellent. Group work, because this is a competency by itself, how to work within a group. So community-based education give us this opportunity to train our students how to work within a group, because after graduation, when they will start practicing the job, they will not work alone. They will work with a medical team that includes nurse and pharmacist and so on. So they have to learn how to work within a group, which is a competency by itself. Excellent. Thank you very much. Who else? Riham Magdi.
Doctor, good evening, doctor, and good evening to my colleagues. I think the community-based this is teach our students the public responsibility and their community, the responsibility toward their community, especially that I'm in the Faculty of Dentistry in Shams University, and our students actually help the public or the people in the hospital, as well as we arrange like convoys to different areas in the here in the to far areas, so that to serve the peoples who are in need of this services. And I think teach our students as well working in team, teach them teamwork.
Okay,
it's very important to our students.
Thank you, Rehan, because unintentionally you addressed a very important point when you said we teach. Community-based education is not about teaching. It's about learning.
Learning, yes. Yes.
So this is the paradigm shift between teaching and learning. Between teacher-based education and learner-centered education.
I think they learn this.
We can't say teach when we address community-based education.
I think, right? Professor, they learn this through their experience with their supervisors in the convoys, the arranged convoys.
Yes, excellent. So this is another thing that community-based education and the problem-based learning came to address, which is the paradigm shift from teaching to learning, from teacher-based education to learner-centered education. Excellent. Who is
okay.
there?
I am here, Professor Wagdi.
Okay.
May I speak? Okay. Okay.
Of course.
I
Go ahead.
am Professor Heba Saadeddin, currently working in Medical College in Juf University in Saudi Arabia, and I am originally from Medical College in Asyut University in Egypt. Okay. First of all, it's my pleasure to meet you and to be with you in this important session. Actually, it was amazing, and we are all proud of Suez Canal program and the integration of community-based education with student center and problem-based learning, of course. So here, regarding the community-based education, actually the very important issue, the early contact between the students and the community, basically from the prioritizing the health problems, the early contact with the community, the patient, the relatives, team working, all these issues help very importantly in their career and in their developing skills very early, and I think it helped a lot in their career.
Thank you very much. You mentioned that in community-based education, we we expose our students to the community very early. We call this early exposure to the community since year one, and this is something unique to community-based education. And you said something about the priority health problems. Okay.
Yes.
Else, because it will be the last contributor now. Who else? Yes, sir.
Amy.
Yeah, go ahead. Dow, Blamey? Yeah.
Yes,
go ahead.
yes. Sorry.
That's all right. Where are you from?
Sorry, sir. I can't sleep. There's too much noise here.
Yeah, no problem. Do you hear us well?
Yeah.
Yeah. So what's your aha moment about what you have learned so far during this session?
I have not heard too much things because, as I said, I am on a boat. It is too noisy.
Okay, no problem.
Yes, it is too noisy.
Okay, let me pick up one more. Sarah, I think Sarah Muhammad didn't contribute yet. Sarah? Either
yes,
Sarah
Doctor.
Muhammad or Sarah Al-Aizabi. Sarah Muhammad.
I can contribute.
Who want to contribute?
I can contribute.
Okay. Go ahead. Where are you from? Omar.
Mustafa. Hi.
Omar.
I'm Omar Alfi. I'm from Badr University. Actually, we're today talking with the
from Pakistan
Dean and Vice Dean at the faculty. Not from Badr University. Badr University in Egypt.
University in Egypt. Okay.
Yeah.
Okay. So
I was talking today to the Dean and Vice Dean.
Okay.
Yeah. We were discussing today how after I did my readings, we were discussing today how to involve the community-based education through vertical and horizontal integration in our curriculums at the university.
Yes, I know this is your role.
And we started to put a plan to do so.
Your group. This is your role within your group. But now we are, discussing and generally, if you are having an aha moment after you've read and watched the educational material available,
yes,
on the website. Okay, what was your aha moment?
It was about the integration of the
integration.
Community-based education in our curriculum. Yes.
Okay. Well, I think before we go to the presenting your PowerPoints, there are some very quick things that I would like to tell you about how community-based education is in a strong relationship with the educational theories in health professions education. You already have talked about integration, about learning versus teaching, about early exposure to the community, about working on the practical part of the curriculum rather than just the theoretical, on so many things, but you didn't mention one important thing, which is relevance. Relevance to what? Relevance to the community health needs and priority health problems. Because in conventional curricula, we usually teach medicine and health professions irrelevant to any health needs or priority health problem in your own community. But in community-based education, because you expose your students to their local and national community, they have the opportunity to address with the community their community health needs and the priority health problems, because after graduation, they should be very competent in handling such health needs and problems that's related to their own community. And when we say community, it doesn't mean it has to be just the local and national, but on the larger horizons, we also have the regional and global community. So our students in community-based education, yes, focus more on the local and national community, but also become very aware with the other horizons like the regional and global communities. By this, I think we have a clear idea about community-based education, but we will go to the specifics after listening to each of the 5 groups. So can we start now by the presentation of group 1? By the way, until they are ready, after they finish, we can have a couple of questions to this group. Each group will be asked some questions from the other 4 groups. Okay? So be ready for that. Okay, go ahead.
Assalamu alaikum.
Walaikum assalam.
I am Dr. Bashair Al-Ruwaili from Jove University. We are first group, inshallah. We will present our question. First question.
You said Jordan University?
No, Jove University.
Jove, okay, in Saudi Arabia.
Yeah.
Okay,
Yeah.
good.
First, we will start. Why did CBE at the beginning emerge in second half of last century? There is a lot of reason. The main reason is or are limitation of traditional hospital-based education, rise of chronic and preventable disease. There is an increase in or transition from acute to more chronic disease. Shift toward primary health care and prevention, especially after Al-Ma'ata, health for all. After that, there is a lot of arising or focusing in social justice, equity, demand for social responsible graduate and doctor. Also, there is a focusing from WHO for community-oriented education. For all that reason, there is an emerging of CBE. We will go to second part of the question with Dr. Ahmed. Thank you.
Thank you. Dr. Ahmed, unmute yourself.
Good evening, everyone. I am Dr. Ahmed Nouri from Protocol of Medicine, Eritrea. Today, I will be talking about the concepts, rationales, and the values of community-based education. Let us start with the concept of CBE. At its core, CBE is about learning in real community settings. It moves education out of the classroom into the community, where the student engage directly with the real-world health challenges. This approach treats the community as a learning partner, emphasizing collaboration and mutual benefit. A student does not just learn from textbook; they learn throughout experiential and service-based learning, where they actively contribute to addressing community health needs. Another key concept of interprofessional education, where the students from different health disciplines work together, fostering teamwork and collaboration. Finally, CBE ensure continuity between education and service delivery, meaning that students learn directly impacts the health and well-being of the community they serve. Now let us talk about the rationale for CBE, why this approach is so important. First, CBE improves the relevance of health professional education by aligning it with the actual need of the community. It ensures that the students are prepared to address the real health challenges, especially in underserved areas. Second, it enhances communication and professionalism skills as the students interact with the diverse populations. Third, CBE strengthens understanding of social determinants of health, such as poverty, education, and housing, which are critical to improve health outcomes. Fourth, it prepares graduates for primary and community care, equipping them with the skills to work in resource-limited setting. And finally, CBE promotes reflective and lifelong learning, encouraging students to continuously adapt and grow as professionals. Lastly, let us explore the values of CBE, which are guiding principle behind this approach. At the heart of the CBE is the social accountability. The idea that educational institutions have a responsibility to address the health need of community they serve. The CBE also emphasizes equity and justice, ensuring that all individuals, regardless of their background, have access to quality care. Another values of is the community partnership, where community are actively involved in shaping the educational processes. Cultural sensitivity also central as a student learn to respect and adapt to the cultural context of the population they serve. And finally, CBE fosters teamwork, leadership, preparing students to work collaboratively and take initiative in addressing complex health challenges. Thank you.
Thank you. Please unmute yourself.
As we can see on the screen, for sure, I adopted this picture from the great video of Dr. Wagdi. As we can see on the left of the screen, it's community-based education. It's kind of engagement of the community and education. So we involve the community in the education process to satisfy the interests of the community. This is like a very real example. Here is a tutor with a student. He gives him, so the learner here is the student. What he gained? Can we just click? Yes. He gains a professional competency in a community setting. So this is the community-based education. It's a pedagogical. Another click, please. Yes. It's a pedagogical model. It's a pedagogical model where there is a direct learner for the student, and there is active participation, and the community here is a partner. We use the community setting. So both the community and the education both will mutually grow. The next screen. In the community-oriented learning, it's an institution. Another click, if you please. It's an institution. There is no more community setting. We will use the community here not as a partner, but as an information source. So the institution will come to make a curriculum. It will be like contextual issues, but it's a theoretical. There is no more hands-on. There are no more skills to just make like engaged graduates, but in the curriculum, but in the institution, not like the curriculum based where we use the community, even we use the community settings to make the learning process. Yeah, thank you.
Is my voice clear here?
Yes.
Yes, we can hear you.
Okay. What are the determinants of community-oriented education? Community-oriented education is shaped by a set of interrelated determinants. Among these determinants are, first, the community health needs. What is the priority health problems in this community? So educational content is driven by what the community actually needs and not by the textbooks. Social accountability, the responsibility of educational institutes towards the society. The graduate should be prepared to serve society efficiently, especially the groups who are really in need. Relevance of the curriculum. Curriculum reflects the real life community problems and focuses on prevention, primary care, and public health. And integration of the basic sciences with clinical and social sciences. Thus, learning is problem-based and context-based. Community participation, where active involvement of the community members and collaboration. Thus, the community is a partner, not a training field. Learning environment. Training occurs in community settings like homes, clinics, and schools, and exposure to the real health systems and real people. Thus, the student learn where people live and receive care. Student-centered education learning. Active learning and self-directed study, the development of communication, leadership, and problem-solving skills, attitude, and behavior changes, not only the development of knowledge, thus the students' involvement in all aspects. Faculty orientation and training of the faculty. Teachers should be trained in community-based teaching methods and the role models for social responsibility, commitment to the community engagement, evaluation and feedback, like assessment of the students' impact on the community health, continuous curriculum evaluation, and the use of community feedback for improvement. Thank you so much.
Thank you, Group 1. I guess this is all about Group 1. Group 1, leave the presentation, please, for a moment. Do you have any questions, the rest of the groups for Group 1? Raise your hand, please. If
yes,
you have a question, yes, Yusuf.
I guess
Ask them, Yusuf, because they are going to ask you. in return.
Okay. I guess it's rather a remark and clarification, even more than a question. It's about the two terminologies: the community-oriented medical education versus community-based education. Thanks a lot, Dr. Islam, for making a distinction. But if one can make it more clear, and I'm quoting from Professor Wajdi, what he has stated in his elegant book, I guess the community-oriented medical education is an educational strategy targeting the needs of the health needs of the community and the priority problems. Now, when it comes to the reality and practicality and how this strategy is become implemented, it is through the community-based education. Therefore, the community-based education is a means by which the community-oriented medical education is implemented.
Thank you,
But
Dr.
one thing I add, in generally speaking, community-based education, according to Professor Wajdi, is a generic term that includes both. So whenever it is said CBE, it includes the both terms. Thanks a lot.
Excellent. Thank you very much, Dr. Yusuf. Dr. Yusuf wanted to make a clear distinction between community-oriented education and community-based education, saying that community-based education is about the health needs or addressing the health needs and community health problems within the curricula. But the students can stay inside their school without even going out to the community. But their curriculum is oriented to the community health needs and the priority. This is community orientation. But community-based education means you send your students out to learn through serving the community itself and work within the community. So this is
Rugby, I think I declared that in the first slide when I said who, how, where, and where was the community setting, and the photo itself. I think it does not relate to any learning association.
Right, Dr. Islam. Okay, can you go back 2 slides to the determinants of community-oriented education? 2 slides back.
Who is responsible for moving the slides?
Yeah, who is responsible?
I am the one.
I
think there's something wrong.
Were you were the one who presented this part, but who moves the slide?
I am the one moving the slides also.
Mary is multitask here.
Yeah, to the slide of the determinants of community-oriented education. I have a question for you.
Okay.
Yes, this one. This one. Because, you know, till 2 years ago, we were talking a lot about community-oriented education. You asked, because, you know what, we all around the world should be defined as community-oriented schools. You can't be a community non-oriented school. So by default, we should be all community-oriented. Then you ask the responsible people, the administration of this school, in terms of what you define yourself as community-oriented. What are the determinants? They don't know. So for the first time, we published a paper at the journal Education for Health, which is the journal of the network towards Unity for Health, for the first time defining the determinants for community-oriented education, which you presented. But when you start with a title like community health needs, and then you just speak about the priority health problems, there is a defect here, because priority health problems are part of the community health needs. Health is usually much bigger than disease, right? So
Yes.
when you talk about community health needs, we are talking about health in general. And the needs include health and illness. But priority health problems is just talking about problems, about diseases, right? So it just, you know, when I looked at the way you put the title and then you spoke about just one
Problems
part of
only.
it.
Okay.
Also in social accountability. Social accountability is 3 levels. It starts by social responsibility, then social responsiveness, then social accountability at its full level. You didn't define exactly the 3 levels of social accountability. Just I wanted to comment on that, but this group actually is excellent. Give them a hand. Bravo. Okay.
Thank you.
Thank you.
Thank you, Doctor.
Should we move now to group 2? See how many hearts and applauses goes to you. Yeah. Okay, group 2. Unmute yourself, please.
Hi, the professor. We'll present about the community. Hi, I'm Omar El Alfi.
Okay.
I'll start presentation for group 2.
Go ahead,
We
Omar.
will say about the community-based education framework for undergraduate medical education. Our group will be Gamal, Maram, Samar, and myself, Muammar Ansar. Our meeting agenda, we'll talk about the meeting agenda. We will talk about the community-based education framework for undergraduate for medical education, the resources, and the classification according to the taxonomy method, the partners where we will be able to gain their help, and the possible rules and different education settings. It's an illustrative picture. Then we will talk about the plan. First of all, the community-based education is an educational approach that places the medical students in community in a setting that address the real health need. At the same time, we are achieving the curricular outcome they have learned in their schools. Our plan will look upon these things. How to conduct community health need assessment, align the CBE objectives with undergraduate medical competences. For example, in our university, we use a NAR system. Integrate the CBE into the curriculum, horizontal and vertical integration. Select appropriate community setting. Prepare faculty, students, and community partners. Implement supervision assessment as well as feedback. Establish monitoring and evaluation as well as sustainability plans. And now I'll leave the mic to Dr. Samar to talk about the resources.
Okay, thank you, Dr. Omar. I'm Dr. Samar from King Saud University, Riyadh, Saudi Arabia. I'll present you the part of resources needed to support a community-based program. They can be categorized into 4 main categories: human resources, financial resources, technical resources, and physical resources. Next. For the human resources, we need a trained faculty, clinical preceptors like a primary care physician from the national community, administrative staff, and student. Next. For the financial resources, we need, for those students, we need transportation and accommodation, faculty incentives and training cost, educational material, whether printed or digital, community project funding, monitoring and evaluation cost. For the technical resources, we need LMS, Learning Management System, data collection tools, surveys, audit tools, or if it's digital, we need tablet or laptops, telecommunication platform and good network connection, evaluation and reporting softwares. For the physical resources, we need a primary healthcare center or community hospital, teaching spaces and skill labs, and student housing where needed. I leave the next slide for Dr. Maram.
Assalamu alaikum. This is me, Maram Abeid, Professor of Endodontics and Faculty of Dentistry at Ain Shams University. The classification of CPE programs according to the taxonomy of CBE, they can be divided into service-oriented or research-oriented programs or training-focused program. Service-oriented program means that it will deliver service to underserved communities. It can be subdivided into health intervention programs or community development programs. The second part is research-oriented program, which will focus in studying community health problems. So the students are going to collect data, observe health issues. Their role is mainly observational. This will be furtherly subdivided into community-based research, where the field research within the community itself. However, the second branch is health facility-based research, where the research is done in a hospital or a clinic with minimal community involvement. The third class of CBE program is training-focused program, which emphasize on clinical or practical training only in the real community setting, such as in primary care units. This part can be subdivided into primary care-oriented training, where the training is done in the primary care units, or community exposure program, which is a short but observational experience described as community sightseeing also. Now Sarah will present the rest. Thank you. Dr. Sarah, you will present the partners.
Unmute yourself.
I'm Dr. Sarah Al-Aizabi, Lecturer of Family Medicine at Ain Shams University. I'm going to present the partners for CBE program and their possible rules. First, the first partner is Ministry of Health through policy support and provide clinical training sites. The second partner, the primary healthcare centers, provide support through offer settings for student supervision and service delivery to the community. Universities and medical schools also are partners through curriculum designing and student teaching and student assessment. Local government and the municipalities also are partners through help the culture guidance, trust building, and community engagement. Community leaders are partners through cultural guidance and trust building and community engagement. International organizations are partners through providing technical and financial support. So I will give the mic to Dr. Muammar.
Thank you, Dr. Sarah. I am Muammar Gabsa from Libyan International University. I will talk about different educational setting involve community-based education. We'll talk about primary health care center. This is provide first contact and prevention and continuous care This is, I think, it is a ideal area for learning and community-oriented service. Setting number 2, community hospitals. This is offer a secondary level health care prevention and disclose the link to the community and allow the student to understand the referral system and continue for care. Result University, this serve as coordinator and academic support and supervise the student reflection and assessment. Also the rural and underserved communities. This is to really
could you specify more the rural and underserved community? How are you going to approach those specifically? Rural and underserved community. How?
This is expose student to real community needs and social determinants of the health and health inequity in the community. That the public health department.
What would be the venue for that? How your students are going to expose to the community members themselves?
I think, Doctor, we can address it by convoys.
Yes, this is one venue.
Mainly.
What else?
Yes.
What else? What about family visits, as you saw in the video? Family visits.
Yes,
okay?
Yes, family visit.
Right, and visiting schools.
Visiting school.
School health. Yes. Okay, go ahead. Move on, please.
Public health department. This is enabling the learning in health promotion, prevention of disease and surveillance, and health policy implementation. Thank you for. If there is any question.
Okay. Leave the presentation, please. Thank you very much, Group 2. We will give you a hand after you respond.
Excuse me.
Okay. Who is that?
Prof. Wagdi.
Yes.
I am Professor Heba. May I have one question to Group 2, Dr. Muammar?
Okay.
What's meant, actually, I wonder about what's meant by public health department here, the different setting involved in CPE. Okay, primary health care centers, community hospitals, universities, of course, and rural communities. And what is public health department? What's meant by this? Is it in medical? Sorry?
Excellent question. If you didn't ask them this particular question, I was about to address it myself. Public health departments. Does this mean that this is the only department that could be involved in community-based education, and the rest of academic and clinical departments wouldn't be involved as well? This is a difficult question to this group.
I think, Doctor, they specify them. We do not mean to specify the family department and other departments will be involved, but public health can be the facilitator or organizer within the different departments, I think, and that's why it is responsible or in charge for the settings.
Thank you, Maram, for your answer, but this is not the right answer, because community-based education, as we said before, is one of the best examples of integration, not just integration between the disciplines, the different disciplines, but integration between the departments themselves. If you just depend on public health departments or even family medicine departments, this will leave the other departments without any participation in
the
program. Let me finish my idea. That's why be careful when you assign the departments to be involved during the planning and implementation of community-based education program, because you have to involve equally all the departments. Even when you send tutors to the community with the students, it doesn't have to be from the public health department or from the family medicine. It could be even from the academic departments like anatomy, histology, pathology, and so on. So when we say integration means integration
at the level of departments. Yes.
Yeah. Even as I said before, it's the highest level, okay, which we call transdisciplinary. It means that all the faculty all together from the different departments participate in all the activities in the planning and implementation.
Yes. Thank you, Prof. Wagdi, for your clarification. Thank you.
You're welcome. Someone was about to say something about this, and I interrupted him. I'm sorry.
Dr. Omar, I think.
Dr. Omar.
انا فهمت طبعا وجهة نظر حضرتك. I think yes. I'm Omar. I think what we meant here that طبعا احنا surely if we will do this we'll apply the horizontal and the vertical integration. But might be the public health department will be the facilitator in the connection between, for example, the dean and vice dean and the people in authorities versus other departments. But of course, if we are going to apply the the education community based concept, of course, there must be integration, vertical as well as horizontal.
Yeah, you forgot that nowadays there are departments called medical education as well.
Yes.
So if you
it's still in our still in our culture لسه hopefully we're gonna do this إن شاء الله.
Yeah, but again we can't just ignore the fact that when you plan you have to involve all the departments together. And when you implement as well, when you train facilitators for community-based education, you train facilitators from all the departments, not just the community health or the family medicine or even the medical education. Okay, thank you very much. Excellent. Yes. Thank you very much. This is group, what, 2 or 3?
2.
Group 2,
okay.
doctor.
Okay.
Any reward for the right answer?
I'm sorry?
Yes, rewards, the actions.
Yeah, of course. Bravo. Give them a hand, please. Okay. Group 3, please.
Okay. This is the team members. By the end of this session, we are going to identify community-based education competences to be integrated into undergraduate health profession curriculum, formulate one specific measurable learning objective for each identified community-based competency, and we are going to design an appropriate community-based learning activity. First question is, what competencies concerning community-based education could be addressed in the curriculum for undergraduate health profession education student? We just modified the competencies according to the scenario that was provided in the handout, in which the community suffers from high mortality rate for maternal mortality rate and infant mortality rate from infection, and maternal from postpartum bleeding and infections, and there is low literacy percentages and high poverty state. The competencies are categorized in 6 categories: public health, cultural competence, leadership management, community-based and community development and advocacy, research and evidence-based practice, and generic skills. Regarding public health, each undergraduate student should be competent in provision of preventive and curative care to infants and women in childbearing periods, provision of screening and health education, advocate health equity by providing the same opportunity in terms of health services and health education to all members of the community, conduct community health assessments, and epidemiological and biostatistic research skills. Some of these competencies will be overlapped within the other categories. Regarding cultural competence, advocating for social justice and eliminating of health disparities, ability to transfer information in a way the patient with low literacy can understand, understanding gender disparities in various illness, understand community norms which affect the healthcare system. Regarding leadership and management, they should be competent in fundraising, plan and evaluation of rural-based health program, collaborative partnership with non-governmental organization in underserved areas, build partnership with between capital-centered academic institutions and communities in rural areas, advocate for health-related policy and resource allocation changes. Regarding community development and advocacy, they should be able to empower local initiatives for vaccines, safe water, and safe air, participate in community activities to promote health and act as a health advocate, awareness of the barriers to access health services in a community. Regarding research and evidence-based practice, they should be able to participate in population-based research, critical appraisal of evidence to design cultural and socioeconomic appropriate care, plan healthcare service for women and children, carry out health policy analysis, implement best evidence in healthcare practice in low-resource communities, and formulate health research questions that address the community needs. Regarding the generic skills, they should be able to effective communication skills, to have effective communication skills with low literacy population, problem solving and critical thinking for common maternal and pediatric conditions, to be able to work in effective teamwork and interdisciplinary approach. From observing these competencies, we can find that there is overlapping nature of competencies. It is one of the important findings that community-based education competencies interrelate and overlap, not only with each other, but also with other clinical competency. We also observe that generic competencies are required in all settings and all levels of care, not only limited to community-based or primary care settings only. For the second question, Dr. Mahrous will join us.
Wow. Where did you get all this information? Are you coming from a community-based education school?
From the pre-reading that you provided us with, sir.
From the readings.
Yes.
Excellent, excellent. Okay.
Okay, thank you, Dr. Daha. Come up with one learning objectives for each competency. Yes. For each competency, which is mentioned by Dr. Daha, public health, culture, competency, leadership, and community development, research, evidence, for each one, we put one learning objectives. Public health, apply basic public health principles to identify a priority health problem and purpose preventive strategies in a defined community. Culture competency, demonstrate culturally sensitive communication and care when interacting with individuals and families from diverse culture and socioeconomic background. Leadership and management, demonstrate basic leadership and organizational skills by planning and coordinating a small-scale community health activity. Community development and advocacy, identify a community health need or advocate for excuse me, let me, this one. Demonstrate basic leadership and organizational community, identify community. Excuse me, because there is an and here in this one, identify a community health need and advocate for visible intervention and collaboration with community leaders or organization. Related to research and evidence-based practice, collect, analyze, and interpret basic community health data and apply evidence-based recommendations to address a health issue. Related to generic skills, demonstrate effective communication, teamwork, and problem-solving skills during community-based health activities. Part 3, Dr. Yusuf, we can complete.
Thanks a lot, Group 3. Thanks a lot, my colleague, Dr. Mahrous. This is me, Yusuf Osman Yusuf, maxillofacial surgeon from the Faculty of Dentistry, University of Khartoum. Can I have the next slide, please?
Okay.
So my role is to translate the objective that has been stated by my colleague, Mahrous, and Mahrous has translated 6 competencies into one single objective. Here, the learning objectives are tailored to each of those these are learning activities tailored to each one of these objectives. And now the first objective was stated as applying basic public health principles to identify a priority health problem and propose preventive strategies in a defined community. Example for community-based education learning activities is that students can conduct a windshield survey. They can observe the community while they are walking, driving, to identify environmental hazards or risk behind infections, diarrhea, and pneumonia. And we have taken these 3 examples because of the scenario that we have been provided to. These are the 3 causative factors for the mortality that has been shown in the given scenario of our group. Then after that, the student can formulate 3 interventional plan, for example, to have a plan for clean water initiative or vaccination drive. Next, please. The second objective was about demonstrating a culturally sensitive communication and care when interacting with individuals and families from diverse culture and socioeconomic backgrounds. As an example of community-based education activities is the home visits. The student can visit a household that student in pairs in a company with local community health workers. They must practice using a non-medical language, avoid medical jargon, and they have to participate and to exercise active listening to understand cultural belief regarding diet or traditional medicine before offering clinical advice. Our third objective is about demonstrate basic leadership and organization skills by planning and coordinating a small-scale community health activity. And this is one of the interesting activities always shouldered by students, like conducting a health fair coordination. They can take the lead in organizing, for example, a mini health day at their local school or community center. They can manage everything, starting from the logistics and budgeting and delegating tasks to their peers. Another example is to organize an oral health awareness day at their university or at their institute. Also, they can shoulder awareness campaigns for the importance, showing the importance of, for example, breastfeeding habits, or they can go for the community, explain for them the role of, for example, smoking and snuff dipping in the in association with oral cancer. Next slide, please. Fourth objective, identify a community health need and advocate for a feasible intervention in collaboration with community leaders or organizations. An example of community-based education activity is stakeholder roundtables. The students can recognize a community issue, for example, lack of clean drinking water in their local community or school, and they can develop a proposal or advocacy brief to present to a school principal or local NGOs representative, requesting support for a practical solution. The fifth objective, collect, analyze, and interpret basic community health data and apply evidence-based recommendations to address a health issue. The suitable community-based education learning activity is to conduct an epidemiological survey where a student can design and administer, for example, a 10-question survey to 30 households regarding a specific issue, for example, prevalence of pneumonia. They then collecting the data and plotting graph and expressing the result and present an evidence-based tips to the community. Also, they can conduct home visits to assess antenatal and postnatal care practices. And also an example is demonstrate an oral hydration therapy for the treatment of diarrhea. Objective, I guess this is the 6th or the 5th, to collect and analyze, interpret basic community health data, and apply evidence-based recommendation to address health issue. The example is to demonstrate team work problem solving through an interdisciplinary case study using the interprofessional education as an approach or strategy where a mix of medical, dental, and nursing and pharmacy students, they collaborate together, participate together, and they can solve a community crisis like diarrhea outbreak or limited resources requiring rapid collaboration, and they can assign the suitable roles for each of the group of students. Now, thanks a lot for your kind listening and attention.
Thank you very much, Group 3. Actually, you've done a great job. This is one of the most difficult groups because it deals with the planning of community-based education, how we plan a module like this. And you were just wonderful. But still, you can accept a few questions from the other group. So who would like to ask this group?
Excuse me, Prof. Wagdi,
Sure.
may I have one question for you regarding the some examples that mentioned by Dr. Yusuf, not hitting the same case scenario. Yani, for example, he is speaking about the awareness day related to the oral hygiene and something like this related to the dentistry field. But our case,
maybe because it's a cause of diarrhea and infection in general, it's a culture of bacteria. So it should be addressed as a source of infection for pneumonia.
I know all this related to the maybe the underlying etiology of diarrhea or mortality rate of infant. It's okay, but here I am speaking about wondering about the yani, is it yani essential to be restricted to the case scenario, or it is allowable or eligible for us to search all over and give an example away from?
We try to commit to the scenario in order to summarize few competencies. If you are going to give it for an imaginary community, we provide multiple tasks.
Thank you,
we try to tailor it to the scenario.
It's okay. Thank you, Dr. Doha.
Give many examples.
I want to hear your opinion, Prof. Wagdi.
Yeah, well, this is a good question because it's related to the field work itself. Should it be completely structured, or semi-structured, or ill-structured according to what the students will find during their community field work? This is a difficult question, but what happens in reality is that it's a combination of all of that. When the students go to the community, they go with certain objectives for the week, which is related to their curriculum, this part of the curriculum. So that's why their field tutors will lead them to areas where they can address such objectives in particular. Right? But what happens if things go beyond what's planned for this day? That's all right, because they report back, even the students report in their portfolios, and the school has a way to reflect on the overall curriculum, what were the extracurricular activities that happened and were not planned, what were the gaps, and what were the overlaps. And then they have to restructure the curriculum or the part of the curriculum for the week so they can adjust for that. So in community-based education, there is much more flexibility than in problem-based learning, because in problem-based learning, we are controlling everything. Everything is under the control of faculty.
Mm-hmm.
But in community-based education, where the students are free-handed to some extent, you can never expect 100% what will happen
Yes,
in the
should
community.
be, there is a flexibility or resilience to make this. Okay, thank you, Professor.
Yes.
Thank you.
Thank you, Group 3. Again, you were great. Should we start now, Group 4?
Yes, Assalamu alaikum. Is the
Alaikum.
presentation clear?
Okay, yeah, it is.
Okay.
It is clear.
Here in Group 4, we have two presentations. The first one for me, Dr. Amani, Professor of Microbiology and Immunology, Juf University, and Dr. Akrima, Associate Professor of Clinical Pathology, Juf University. Our objective, what are the possible student assessment approach and tools that match community-based education, and how one can use them at the field field site والcommunity and the campus.
Here
As
comes
all
the tool assessment, because one of your colleagues was
yes,
asking about
I'll present only the assessment approaches and tools. As you know, all the assessment in community-based education should be competency focused and continuous and practice-oriented to focus on the actual practice performance, community interaction, problem solving, and professional attitude. This is to measure how effectively students apply theoretical knowledge in real community setting. We choose 5 main assessment approach: reflective assessment, performance-based assessment, portfolio-based assessment, collaborative partner evaluation, and project-based and community-based assessment. In the reflective assessment, the students link their academic theory with the social real performance, such as writing reflective journals or analytical reports, incidents report, to critically analyze their experience, identify learning gaps, and link theory to practice. The tools, as I mentioned before, analytical records or reflective journals and incidents report. Regarding the performance-based assessment, this is to evaluate the student ability to apply this knowledge and skills in real community. Students are assessed regarding their communication, teamwork, problem solving, how to deliver this to the community through direct observation checklist, written or oral presentation. Regarding the portfolio-based assessment, students document their experience, case study, activities, reflection in their portfolios or logbook. Sometimes they make a case presentation and report, which is assessed or evaluated by their mentors. Collaborative and partner evaluation. This assessment includes feedback from both the community member and the organization served. The assessment tool is satisfaction surveys, review meeting, supervisors, and community feedback forms. The last one is project-based and community assessment. Students are evaluated based on the community diagnosis, health education activity, intervention, project presentations that address the community need. The tools are project portfolio and community action plan, public presentation. تفضل دكتور عكرمة. Thank you.
Thank you.
Assalamu alaikum.
Alaikum.
I will answer the second part of my questions here. How one could use these assessment tools, which already my colleagues explained, at 3 levels: in the field site level, community level, and in campus. Actually, I try to summarize everything in this schedule to keep it simple for us. But we have to mention some point. For the field site, the assessment should be authentic performance and the progression decisions. For example, we have in the field site, usually we use a direct observation checklist in which the on-site supervisor will be evaluate the professional behavior and technical application in the real-time practice. We have also logbooks and performance rubrics to evaluate the practical skills, communication skills also with the community members or teamwork. Also, there is immediate feedback is provided to improve the competency. For the community level, should be assessment tools. It is used to be those best one. It is to assess the social accountability and the health advocacy and system-based practice. For example, we have community forums or focus groups where the resident provide feedback. Also, we have student can also conduct a community needs assessment to identify service priority. Also, the assessment focusing on the students' ability to identify community needs, solve problems, and implement interventions. For the on the campus level, should be used the tools which is the best for the early competency development, safe practice, and standardization. For example, we have faculty assist the student through the portfolio review and reflective reports, seminars, and case presentation. Also, the academic discussions help integrate the theory with community experience. Thank you.
For the second part, Dr. Siddiq and Dr. Muhammad should share their screen.
Yeah. Can you? Yes. Okay. Is my slide visible?
Yes.
Okay. So our topic is role of community and representatives in facilitating students' learning and assessment in community setting. So in my team, I have my friends, Dr. SVV, Chandrasekhar, and Dr. Sara Muhammad. So our objectives of the community-based program, the community-based program aims to show the impact of disease on families and communities, help students view patients as part of their families and communities, clarify the workings of health system and role of teamwork, develop skills in research, problem solving, communication, decision-making, clinical techniques, leadership, organization, and teamwork, and teach behavioral science such as medical sociology, psychology, anthropology, and economics. Now, as you know that it is a form of instruction where students can learn professional competencies in a community setting to help students build a sense of connection with their communities. It's a popular approach for all forms of education and for all age groups, especially at higher education level, where the primary purpose is to foster interdependence between education and communities for enhancing the capacity of individuals and groups for improving the quality of life. Now we have the role of facilitating learning. So I think I'll invite Dr. Sara to continue.
Assalamu alaikum.
Alaikum assalam.
We will go to the part of role in facilitating students' learning. It will provide a realistic learning environment and support, and this will be by community leaders and members, offering student practical real-world learning environments, responsible for student accommodation, food during their posting, and provide general support. This exposure allows students to work in settings similar to those they will encounter in their future career, particularly in underserved and rural area, and to understand the impact of these on families and communities. Next slide, please, Dr. Muhammad. Second rule in facilitating is to enable skill acquisition through direct interaction. The community facilitate the development of essential skills such as communication, problem solving, teamwork. Students learn by interacting with community members, practicing effective communication, listening to community problem, and offering advice that is culturally appropriate and understood. This direct engagement is vital for students to acquire the competence needed for community-oriented health care. Next part was Dr. SBB.
Yeah, hello, good evening, Dr. SBV Chandrasekhar here. So we are going to see about the community representatives for the CBME sake. So it is a support that is given from the community, which is a must. For this support, we need to orient, train, and prioritize the issues for the student. And based on this, we have to go for a planning and time allocation for the students, which will help us in making and establishing a community-based education system. The steps for this which can be included are like community exposure and trust. We should gain the trust of that particular community. And if any problem is there, we have to go for a community diagnosis. And we need to go for a mobilization of the community and making them empowered for that, for the activity. Community participation, which will enhance the participation of the community. And community and university local partnership also, so that as a whole. So after that, then community, so that things can be to the next slide.
Thank you.
Say for the next slide.
Thank you. Is this the end of the fourth or fifth group?
Fourth, sir.
Fourth group.
Fourth group.
Yes, about student assessment, right?
Yes.
And is there questions for this group? I think Dr. Ahmed Osman, we want to ask you a question, or because you were raising your hand. In case there is no questions for this group, I have a question. Could you tell us two specific situations where the community itself can participate in assessing the students?
Hello.
Can I
Yes.
answer? One situation. يعني student feedback, community feedback is very important in assessment of the student regarding مثلا educational campaign or something like this. Student will present a case, will explain for the community members مثلا how to perform يعني for example vaccine, the importance of vaccines and where it is available.
But
we
me,
can get
Dr.
the feedback
Amani,
from the community.
Dr. Amani, tell me
Yes.
how specifically the community can evaluate the student in such situation that you describe. How?
I can explain one example. مثلا, sometimes when we go with the student in community survey campaigns, there is a barcode to know what the student explained to them, and the final one to evaluate what they get from the student and how they deal with them, to get feedback from the community.
And you trust the community in evaluating the student in such case?
Yes. Why
Okay.
يعني هواي مثلا also in school campaigns يعني هواي student هواي community will tell lie مثلا أو هواي not to be trusted. And a
I
student
didn't
make a
mean
campaign
blind, of course.
for
Yeah, yeah.
yes.
But if
Okay.
what if we look at situations where the community receive direct service from the students, so they have the right to evaluate such service which is provided to them. I will give you a couple of examples. The first example is the family visits, right? Because you send your students to the families regularly and on a regular basis, and then the families have the right to evaluate the kind of service that's provided to them through specific students by name. So this is one concrete example of how. The other example is during conducting community projects by the students. By the end of the projects, when the students defend their projects in the school, we invite community representatives to attend and to sit in the panel and share in the evaluation, because they are the one who know exactly what was happening in the community settings during conducting such projects. So their opinion is highly important to be included among the opinion of the faculty and the peers and everything during evaluation of the projects. Okay. Thank you very much. We still have another group, right? Group 5.
Yes.
Yes, doctor.
I'm
Dr.
sorry, I
Heba?
didn't hear you.
Yes, Dr. Heba will share the presentation.
Okay.
Dr. Heba or me?
We have less than 20 minutes, so we will run quickly through the 5th presentation. Please, Dr. Heba.
Okay, just 1 second, please. Okay.
Okay, sure.
Replace current. Yes. I think it's clear now.
Not yet. Yeah, now it's clear.
Just 1 second, please. Yes. Okay.
Yes.
I think Dr. Iham, can you start, Dr. Iham?
Good evening, dear professors and my colleagues. I represent the second part of Group 5, the second question.
Good evening.
I am Rihan Mohammed Salim, and with me Dr. Zainab Mohammed Dia and Dr. Heba Mohammed Saadeddin. Our question was, the second slide, please, Dr. Heba.
Okay.
Would you please bring the first slide containing our question?
First?
Slide number 1.
Okay.
Slide number 1, please, Dr. Heba.
Okay.
Yes. Thank you. What are the levels of community involvement that are expected to happen within a community-based education program? First of all, we tried to relate our presentation with the scenario that was attached in the handout file on the Moodle. So, please, Dr. Hema. Yes. In community-based education and according to the staircase model, community involvement progresses through levels to build trust and deepening collaboration. In our scenario, this staircase is particularly relevant because there is a rural majority, which is 65%, with inequitable access to health services, means CBE must prioritize rural placement. Also, high infant and maternal mortality rates, giving a highlight urgent health needs that students can address through preventive and primary care projects. In addition to low literacy, 32%, which require culturally sensitive, community-driven health education strategies. Levels of community involvement. There are 6 levels for the community involvement. The first level is community exposure and building trust. And these begin with identifying informal leaders, elders, mothers, and religious figures. And it is important to engage them early by advisory roles, listening sessions, rural training sites, and to promote the interprofessional collaboration like medical, nursing, pharmacy, and dental students to work together in the rural health. And this will prioritize urgent community needs like infant diarrhea, pneumonia, hemorrhage, infections, and this will lead to building trust through transparency, consistency, and empowerment. The second level is community diagnosis, and in our community, there was major inequities between rural and urban populations, beside weak primary health infrastructure in remote areas, in addition to a mismatch between health professional training and actual community needs, and high burden of preventable maternal and child illness. Dr. Zina.
Good evening all. I am Zainab Daya. So the second 2 steps are community mobilization and empowerment, as well as community participation. So through these steps, we go into sequential steps. The first one is identifying the problem, which is already discussed by my colleague, followed by assessing the current situation, which we already have the demographic data for the current situation. The problem lies in very low health services in postpartum women and infants, and high mortality rates in the rural areas. So we're gonna start by raising the awareness. Raising the awareness will be done mainly through health literacy campaigns. These are to enlighten people of the real problem and its importance. So we are gonna head for the population through health literacy campaigns by press releases, TV media, mobile phone applications, either SMSs or WhatsApp messages. And the aim is to include messages regarding maternal health, infant care, hygiene, and nutrition. And we should go for strategies, simple strategies like storytelling strategies or visual aids, because the literacy levels are actually very low in these rural areas. And we need as well to involve the right people and the important people through press conferences, through presentations with data, mortality rates, comparisons between rural and urban areas. And then we will move to the next step, which is building coalition. Building coalition, we need to build it to have one vision between different entities, which are the government, the medical school, the nursing school, and the elderly people, the women groups. We should have a common vision to push our mission forward by having a single mission for all the categories. Then we need to do an action plan. The action plan is in the form of involving people for public health workers. These are the medical schools and the medical tutors will teach these health workers the basics in health services. We need to have mobile clinics to visit these rural areas. We need to use all the resources to implement the basic health services, and we need to make sure that we have the medical supplies available for them. Then we go through the stage of monitoring the process through health committees. These are local peoples that will record back or give feedback about the process. And we can do door-to-door surveys by medical students, as well as feedback through suggestion boxes and community meetings. I will leave you with Dr. Heba to continue the next 2 steps. Thank you.
Thank you, Dr. Zainab. And now thank you, Dr. Riham, Dr. Zainab, after giving an introduction about the early community exposure and the diagnosis and finally community collaborations. Now we will shift to the important item related to the same question, which is the partnership between community, university, and local government. Actually, this collaboration is in form of playing an active role in establishing a local health posts that might give a significant impact on areas deprived from basic health services. Actually, it will be through the funding of these health posts. These health posts, together with university, medical faculties, and funding agency, all they work together to achieve by using the resources of community, which is land, manpower, administrative staff, to targeting to creating a sustainable healthcare system for future. One of the most important constructive approach that will be mentioned as an example to promote a health and development is through NGOs, which is establishing non-governmental organization that empower the local people to spearhead interrelated projects such as recycling of waste, extraction organic material, for example, that help in fundraising or make some sort of maintenance or sustainability. Another suggestions actually that may be given that related to increase the GBD expenditure in health, to 4 to 5%. Also reduction, in education to 4%, the increasing GBD expenditure, and reduction of the poverty below 10%. This is by organization, community-based group of local people to promote literacy. And then we will go to the last issue related to the sustainability and very important item, what's related to the community, what's called community winning. Sustainability and community winning can be achieved by 4 important issues. Empowering communities, of course, through NGOs and the other, as mentioned, it could be a powerful catalyst for this independent growth. The second issue here is the maturity of community that can be seen in moving toward what we call self-reliant, totally independent. And the academic staff role now will be restricted to monitoring, advising, investigating, documenting the suggestions that come through the community members themselves. So they are now independent and can share in making a decision and health services. And lastly, by all these mentioned items, we can move from the initial stage, which is building the trust, to our ultimate goal in achieving the sustainability or community winning. That's it. Thank you. I'm ready for a question. Thank you.
Wow, I'm speechless. Excellent group.
Thank you.
Is there any questions for this group?
Yes, that's excellent. So I think there is no questions.
Okay. Who?
Thank you, Dr. Islam.
Akrema, you were raising your hand. Dr. Akrem.
Sorry, but by mistake.
Okay, no problem. Chandra. Dr. Chandra. Also,
yes, claps are claps.
Prof. Dr. Hiba is always excellent.
Thank you very much, Dr. Muhammad. Thank you for your work.
Thank you. Thank you.
Well, as long as there is no more questions, I have a little advice for you.
Yes.
Is to mention your references at the footer for every slide, especially when you quote from a specific reference, because this was lacking in all the presentations. This is one thing. The other thing is not actually an advice, but when I go back to group 2, I believe there are the ones who addressed the taxonomy of community-based education. If you remember, there were 3 main domains. the training, the research, and do you remember what was the third one? Training, research, and service.
Service-oriented.
Okay. What do you expect if we compare the developing countries from developed countries? Both can apply community-based education. But according to your expectations, the developing countries will focus more on which one of the three, and the developed countries will focus on which one?
I believe the developing countries will focus on services.
Please,
yes, of
please.
course.
We're all
Yes.
speaking at the same time. Let me
One by
choose.
one. Okay.
Yeah, one by one. Raise your hand. Okay, Zainab.
I believe the developing countries will focus more on services, while the developed countries will focus more on research.
Unfortunately, the opposite.
Really?
Zainab.
I think
You
because
know,
it's of the finance.
let me explain why I'm saying that. Let me explain why I'm saying that.
Okay.
You know, in developing countries, especially in the rural areas, they are very far away from the governmental services, especially the health service. That's why when a medical school is located within a community, especially remote communities, they expect that this community will compensate them for what's missing from the government. That's why the service component here is very important. And it will lead to more and more trust if they benefit from the health services that the community-based education school will provide to them. Versus the developed countries, where health services reach every inch of the country. They don't really need additional service components, but they are all interested in research.
Yes,
That's why the
this
research
is
part is very well developed in developed countries.
yes, this is exactly what I said, that developed countries will focus on research while developing countries will focus more on services,
Okay,
right?
so
Yes.
excuse me then. I thought you said
The opposite.
Okay. Okay. We're all exhausted by now. That's why, excuse me if I heard it.
Not at all.
The
Not at all,
opposite
dear
way.
Professor.
Very well. I think you are just one of the best batches that I have ever met during the 20 years I served at FAMR, whether international FAMR or the regional FAMRs where I teach in different regional.
All the
Thank you,
thanks
sir,
goes
for
to
this
you, Dr. Wal.
compliment.
You
And I think,
are
Dr. Wal,
just
the
great.
video should be like should be spread virally. The video of Suez Canal, I think it's something inspiring because it happens in the ancient times. I will not say old
It's not
times.
ancient.
And
It's
yes, if you look at the camera, the resolution, everything, it's
Yeah.
I found some farmers dressed in like
Yes.
like very
Yes.
and they are running in the streets. I think that's not happening right now. Sure.
You know, I hear such comments in the
Yes.
especially in the international FAMR. They
because
always
I have come from like a
yeah.
countryside village, so I know this well for sure.
Thank you very much. You were all great.
Thank you,
We
Professor.
will meet again
Thank
next year, inshallah, in the problem-based learning session. And excuse me if I took this much time as one shot without giving you a break, but because this session is really a very rich session that exhausts all this time just for the ideas to be clear in your mind. Thank you so much and have a nice day. And before you leave, let's take a group photo. Ms. Hikmat, please, all of you open your cameras, and let's take a group. Unshare this presentation, please. Yeah.
Dr. Heba.
Dr. Heba.
Yes.
Unshare your
Okay,
screen.
just 1 second, please.
Okay. Because our actions now after 2 hours is a little slow.
Yes, of
We're
course.
all exhausted.
I'm sorry
Yeah.
for this. Just 1 second,
No,
please.
no, that's all right.
Unshare.
Yes, unshare.
I think
Just
already
close
unshared.
it.
It's
Professor
already
Heba,
unshared. It's
No.
okay?
No, it is
No,
shared.
Still shared?
no, we can still see it.
Yeah.
Stop
Just
share.
here from unshare.
Professor
Stop
Heba, you don't
share.
want to go, huh?
No, I don't want to go without taking a picture with all of you.
Yes. Yeah.
Yes.
Can I post it on LinkedIn, Dr. Wagdi?
Okay. Yes,
Yes.
please. Yes,
Thank you.
please.
I'm gonna do it.
Okay. In case we are having a technical difficulty now. Yeah,
I
yeah.
can take the
yeah.
screenshots from the
You already,
MacBook Pro
you
right now.
already have unshare.
Yeah, just open the camera and I will get a shot.
Okay. Okay. Let me do that.
Please smile, Dr. Shireen.
Yes.
Yes.
Here I am.
3, 2, 1.
Thank you so much.
Thank you so much.
Thank you so much. Okay.
Thank you,
Thank
dear
Okay.
Professor. It was a pleasure.
Have a
Thank
nice
you
day
so much.
now.
Have a nice day.
Okay.
Thank you.
Thank
Bye.
you.
Bye-bye.
Bye.
Bye.
Bye. Salam alaikum.
تروبونين بتاع العين 15,000. اسف.
قول تاني كده.
تروبونين 15,000 بيرسنت.
هو في حاجة؟
عالم
عن إذن حضراتكم، تصبحوا على خير.